Welcome to today's webinar on the Center for Democracy and Technology's report about AI used for public benefits determinations. I'm Riddhi Shetty. I'm a policy counsel on CDT's Privacy and Data Project. With that, I'll hand it off to Alexandra Reeve Givens, President and CEO of CDT.
Thank you so much, Riddhi, and thank you everyone for joining us today. Today's panel is the culmination of several months of collaboration with lawyers and advocates. We're very grateful to the Ford Foundation for supporting this important work. Today is also a next step that follows years of frontline advocacy inside and outside the courtroom by our panelists and so many others who work on these issues. As we're all well aware, government decisions that affect our day-to-day lives are too often made and acted upon without people feeling like they are involved in those decisions and that we have knowledge and input into what's going on. Governments these days are increasingly turning to algorithms that limit or entirely replace human involvement in making important decisions about people's lives. We refer to this as algorithm-driven decision-making. In some instances, the hope is that algorithms will make governments work more smoothly, efficiently, and quickly. But unfortunately, in many instances, these beliefs have proven to be inaccurate at best. Rather than increasing speed and ease, in many instances, algorithm decision-making has made delays, caused confusion, and left people out of the loop in really critical decisions about their lives. Decisions impacting people's access to benefit have a dramatic impact on their quality of life, upending critical living and care arrangements, their independence, their ability to get out of the house, and to have freedom during their daily lives. These are the types of issues that we're focused on in this paper, looking at how decisions are made about access to benefits and making sure that those processes are done thoughtfully, inclusively, responsibly, and in a way that restores agency to the decision-making process for the peoples whose lives will be so affected. This paper is designed to bring this problem further into the light while also empowering advocates. Tomorrow, we're going to be releasing a published report that outlines strategies that challenge the reduction of benefits that have been come about through algorithmic decision-making, helping people understand what are their rights, what are some of the legal strategies that are working in court, and how can you step up to speak out on these issues and help states adopt these tools more responsibly, and more importantly, pause to consider whether these tools are the right things for them to be developing at all. I'll turn it over now to Lydia XC Brown, who's a policy counsel on CDT's Privacy and Data Project. Lydia and I began collaborating on this report while we worked together at Georgetown before bringing it to CDT, and I'm thrilled for them to present the legal underpinnings and the structure of this conversation before we then turn to the wonderful group of panelists who will reflect on their own experiences. So again, thank you so much for being with us today. And Lydia, I'll pass it over to you. Thank you.
Thank you, Alex. We began today's conversation in January 2020 at a symposium convened at Georgetown Law, where we convened lawyers, plaintiffs, advocates, and researchers for a series of workshops. During these workshops, we discussed the harms that can result from state governments using algorithm-driven decision-making to make benefits determinations. We discussed the progress and challenges when people whose benefits have been reduced or terminated as a result of these systems sue state governments to seek redress. We discussed instances where algorithm-driven decision-making is used in a way that violates the Constitution and federal law against disability-based discrimination. Over the course of this symposium and our research, we saw the importance of the network of disabled people who advocate for ourselves, our family members who advocate on our behalf, and disability rights lawyers. Building this network and connecting people to strategies and immediate steps is crucial to holding states accountable for algorithm-driven benefits determinations. To that end, we set forth to develop our report, challenging the use of algorithm-driven decision-making in benefits determinations affecting people with disabilities. Much of the report focuses on home and community-based services provided under a section of the Medicaid Act. This section allows states to reimburse the cost of hours of care provided to disabled people in their homes so they don't have to live in an institution to receive care. However, the analysis and strategies in this report apply to public benefits generally. The central argument of this report is simple. Using algorithm-driven decision-making to cut public benefits can violate the Constitution and discriminate against people with disabilities. We break down these arguments to better understand their successes and challenges in court. First, algorithm-driven determinations can violate due process. This happens when states don't provide notice, meaning they don't let people know ahead of time that their benefits are going to be cut. This denies people a chance to tell states that they're making the wrong decision before the benefits are cut. Even when states do provide notice, however, their notice often doesn't give a clear, helpful explanation for people with disabilities to understand how the state made its decision, making it hard for people to push back. States may also violate due process when a beneficiary is denied the opportunity to be heard, to challenge the denial of benefits. It doesn't just mean having a hearing. It means being able to ask someone on staff to review the determination before starting the appeals process. It means ensuring beneficiaries have the help they need to prepare for the appeal and help during the appeal. It means having an appeal that is actually fair, where states don't just win by default simply because people don't have enough information about the algorithms involved to have a chance to know where states went wrong. Second, states may violate statutory requirements when they start using new algorithm-driven decision-making tools without informing the public first. The opportunity to be heard also means having a chance for the public to weigh in on how, and importantly, whether any tool that will change their access to benefits should be used through a process called notice and comment rulemaking. This process requires states to publicly explain the rules they want to make and to allow people to submit statements expressing why they are for or against those rules. And third, algorithm-driven decision-making tools may violate the community integration mandate of the Americans with Disabilities Act when they cut people's benefits so much they place them at risk of going into an institution to receive necessary care, care that they can and should be able to receive at home. This increases the risk that people with disabilities will have to live in an institution to get the amount of care they need. Making people with disabilities live separately from people without disabilities is an act of discrimination. Disabled people have the right to live in and be included and involved in our communities. When denial of benefits deprives us of this right, it is a form of ableist discrimination. While these issues are clear, some disabled people have had more success than others when they've sued over the algorithm-driven decision-making. And their successes don't always lead to long-term relief. Our goal is for this report to be a bridge between past cases and next steps for disabled people developing their strategies to challenge algorithm-driven determinations. Our report also recommends ways to make disability rights and disability justice a higher priority when algorithm-driven decision-making is involved. We're so glad to have a special opportunity today to hear from people who have fought and continue to fight the harms of algorithms. With that, I'll turn it over to our panel.
Thank you, Lydia. I'm excited to moderate today's panel, so let's introduce our panelists. Tina Smith Nelson is a manager and supervising attorney at the AARP Legal Counsel for the Elderly, where she manages civil litigation on behalf of DC seniors across multiple projects in the economic and healthcare security practice, including the public benefits and homebound elderly legal projects. Kevin DeLeban is currently the Director of Advocacy for Legal Aid of Arkansas, where he previously managed the Economic Justice Practice Group. Kevin works with low-income people living in Arkansas to address numerous legal issues, including Medicaid, employment, and disability rights. And Tammy Dobbs is a self-advocate for disability rights who, with Kevin, successfully fought Arkansas's use of an algorithm that drastically cut the hours of care for people who were receiving the AR Choices Home and Community-Based Services waiver. So let's start with the attorneys challenging algorithm-driven decision-making tools in court. So Tina and Kevin, our report describes how courts have analyzed cases against these tools. What arguments have been effective in court, and what recommendations would you have for building a solid court case? Why don't we start with Tina?
Hello, thank you, Ridgely. I'm sorry if I'm mispronouncing your name. And thank you for inviting me to be a part of this important panel discussion today. In terms of the work that we do at Legal Counsel for the Elderly, a couple of the arguments that we have made in building a solid case are to actually attack the government violating its own regulations. Oftentimes we have seen in some of our cases where the regulations require a certain thing, such as in terms of conducting an assessment that a nurse assessor looked back seven days in terms of determining the health care of a beneficiary or applicant, but during the assessment, they only look back 3 days. And so the government has, in effect, violated their own regulation. And so in building a solid court case, we have looked at those cases in which the government has actually violated their own regulation. One other thing that we have noticed and have discussed in some of our cases is we had one particular case where in terms of whether or not a client was eligible to and met the level of care certification, it says under the regulations that if you meet a particular score, then you meet level of care. We had a case where the person met a particular score, but unfortunately, the nurse assessor and the government found that they did not meet level of care. And so we successfully argued that the government was actually violating its own regulation because under their own algorithm, the client met the proper score, but yet was still found not eligible because they did not meet level of care. So attacking the government's own violations, being aware of those regulations and clear of those regulations is very helpful in building a solid case. Also, I think it is important for advocates to define the scope of the hearing in terms of building a solid case. Some judges, in terms of conducting the evidentiary hearing, will only consider evidence that existed up until the time that the beneficiary filed the request to file a fair hearing. Some judges will allow in evidence up until the time that the trial occurs, that evidentiary hearing has occurred. So it's important to define the scope of the hearing so that you will know what information you need to have available in arguing your case and making sure that you have available all the medical evidence, all of the witnesses that you will need to build your case before that particular judge. We also find it very important and helpful to attack the assessment process itself in building your case. Questions about whether or not the nurse assessor had access to and actually reviewed the medical records that were available that really describe the medical condition fully and completely of the beneficiary. Attacking the assessment process in terms of the length of time that an assessment was conducted. We've had cases that have had assessments range from an assessment that took 30 minutes to assessment that took 2 hours. So that is another solid thing that you want to be aware of, how long the assessment took place by the person that was conducting the assessment, and even where the assessment was conducted. We've had cases where the assessment was conducted at the place where the client or the beneficiary was having dialysis, which in itself violates so many rules and regulations. So being aware of those allows you to actually attack the process of the assessment. Oftentimes, we also see errors in the assessment itself, particularly as related to scoring. Um, Sometimes the nurse assessors don't add up the numbers correctly. And so where the person should receive a particular score that would enable them to be found eligible, they're not, because there was some type of error actually done in the assessment. And also in terms of the person who is typically testifying on behalf of the government, we want to make sure, or one thing that you can attack is whether or not the person who is testifying is the person that actually conducted the assessment, and whether they have any independent recollection of the assessment process itself. Because sometimes the person who's actually testifying on behalf of the government is not the person who actually conducted the assessment. And so they really are not able to paint an accurate picture for the judge as to the necessary healthcare treatment that this person needs. We also have found a way to attack in terms of language access. If assessments were conducted in a language in which it's not the primary language of the beneficiary, that is another way to solidly build your case if that person did not have access to those interpretive services that they need. And making sure that the parties are present that need to be present for the assessment. So was a power of attorney present? Was a guardian present? Was an attorney present? In our office, was one of the ombudsmen present for the assessment? So those are also ways to solidly build your case and attack the assessment itself. And then to make sure that you call those individuals as witnesses for your case. And then we can also obviously attack the tool itself. We've had great decisions from some of the judges that have heard our cases where they in fact have found that the tool has been imperfect or is imperfect. It doesn't really accurately reflect the regulatory scheme, which is the purpose of the statute providing PCA services. The tool is rote and inflexible and doesn't consider the reality and practical needs of the beneficiary's health condition, and also doesn't take into account the client's mental health capacity as well. So those are some of the things that we have done to attack the process itself in preparing these cases for trial.
Kevin?
Sure, and I guess for everybody, there's kind of a couple levels where we might be working on here. One is the administrative hearing level, right? So when the state agency says, hey, we're cutting your benefits, you have the option of appealing that through a state agency process, which has an administrative law judge that may or may not be a lawyer, has different rules of evidence, where we practice there all the time, but I've had private attorneys who are not used to administrative law judges say that it's kangaroo court. In other words, poor people get a different level of justice in terms of procedural protections than other people. But fighting things in the administrative law judge setting in the appeals hearings, we've adopted many of the same tactics that Tina had just described. The thing that we've also done has been very intentional about filing affirmative litigation, getting in federal court or getting in state court to challenge the tool itself, not just the individual determinations that the tool makes one by one. And they're the kind of arguments that are successful have been largely process-based. So as Lydia referred to in the introduction, the state is cutting your benefits, but is not telling you why, right? And Tammy will tell you more about this, but basically they just say, oh, the computer did it. Right, with no forewarning, no knowledge, switching from a system that had worked for many years where a nurse would come out and determine what you need. So there's the due process arguments. They're making decisions according to standards that you can't understand or access. They're not providing you notice. They're not allowing you to present all the information or evidence that would be relevant to a determination. So you can get a federal or state court judge potentially to say, nah, maybe they can use the assessment and maybe they can cut your benefits, But before they do that, they have to give you all these procedural safeguards. The other big procedural claim that we've made is that it violates rulemaking. Whenever a state adopts a new policy of any sort that's going to affect real people, it has to go through a process of public notice and comment period. And ideally, the state lets you know what they're going to do. They give the public, anybody, a chance to comment on what they're about to do. And then the state is supposed to take those comments and then maybe reconsider their policy in light of them before implementing it. And what we saw in Arkansas and what we've seen many other places is that the state doesn't do that right. They don't let you know that they're using an algorithm at all, or they don't tell you how the algorithm works enough so that you can comment on it, or they do, but they just ignore the comments that you offer and still go forward with it. And so in the US, we're generally limited to these process-based claims, as well as some of the disability discrimination claims that Lydia's talked about and that we can talk about more later.
Thank you so much. Let's turn to Tammy. Our report details how people with disabilities often only find out that states are using algorithm-driven decision-making tools after their benefits are cut. And we also discuss how states don't always explain these tools well or at all. When your state started using these tools, what was the immediate impact that these tools had on you, and how much information was available to you about these tools?
Well, the algorithm reduced my hours from 56 a week to 32 a week, which equaled out to be 4 hours a day. And I had to do without a lot of things. I had to limit my drinking because it limited my bathroom trips. And that made me dehydrated. And so I had to eat quick meals because in an hour, it equaled out an hour in the morning, an hour at noon, and an hour at like dinner time, and 1 hour at bedtime. So I had to divide up my chores. And so I had to eat quick meals because the aide didn't have time to cook a meal, me eat it, and me go to the bathroom in an hour. And so at bedtime, I had limited bath during the week because I had to have time to go to bed, get ready to go to bed, do my medicine, do my changing the clothes, and, things like that within the hour time. So that put a limit on other things that I needed to be done too. And no, I did not get a warning at the first evaluation. They came in here just happy as could be and sat down here and did the evaluation. And then they told me, well, your hours is cut from the 56 to the 32. Well, I was devastated because the only thing I could think of was the nursing home that would be equivalent to what I was doing here. And I sure didn't want to do that. So that's how it was, it was just terrible. They didn't announce it, or say anything about it before.
Thank you, Tammy. Let's turn back to Tina and Kevin and talk more about that. We also talked about how litigation alone is not always effective without turning to other tactics and collaborators. Or even if litigation is successful, it operates as kind of a reset button and the government goes back and starts the process of implementing algorithm-driven tools all over again. And then we see the same story occur again and again. What strategies should advocates be prepared to use to supplement or amplify their efforts in the courtroom to push back against this? How about we start with Kevin this time?
Sure. So from the beginning, we thought of the lawsuits as kind of a rallying point, but we knew that the relief that a judge is going to order is going to be limited or of limited duration or whatever else it was. And so we knew that there had to be a broader solution. And so We had a lot of wonderful people like Tammy advocating, and the way that we helped get everybody together is we had community education sessions around the state, for example, where we talked about what was going on. We let our networks know, hey, this is happening, or the providers who provide the services who aren't happy that there were cuts, let them know what's happening, provide valuable information. We tracked the ways that the algorithm operated absurdly. So I called it algorithmic absurdities. And we would track all the ways like, oh, wait, somebody who gets tube feeding might get less hours than somebody who doesn't, right? Or various other iterations in which the algorithm itself just didn't make any sense, which helps people understand like, hey, part of the problem is the cuts, that's the worst thing, but also this thing just doesn't add up. And the other thing we did is, thanks to wonderful people like Tammy, who were just ready to advocate and do what they could to change everything, is we produced videos of our clients' lives that we were then able to use in kind of a social media realm so that people could share something and say, hey, wait, that's happened to me. This is what's going on. And that got a lot of traction, as well as very intentional and widespread media use. And so we just did this whole thing. And that's what ultimately achieved legal victories, but also a political victory where the legislature said, no, you've got to get rid of this algorithm, no more. They replaced it with something new, which has a new set of winners and losers and has its own problems. But on the whole, it doesn't seem as bad as what we got rid of. So, incremental progress.
Tina?
Well, unlike for Kevin in Arkansas, we still unfortunately are living under an algorithm in the District of Columbia. And, in addition to just, preparing to make arguments within our court cases, focusing on the disconnection between the numbers that these algorithms are generated and the actual client need, in terms of, the algorithm really doesn't take into consideration cognitive issues that our clients may have. They also don't take into consideration of IADLs with the individual activities of daily living, such as assisting with meal prep, assisting with medication, and pointing out the disparities between the algorithms and the data, because we know that the data that is input and output is only as good as the information that it is fed. So, pointing out, disparity of the ranges and scores that these nurse assessors are putting in to get a number, and the ranges and how these actual numbers actually translate into hours. We've never really gotten an explanation as to how that occurs. But we've also, looked at doing things outside of the courthouse to kind of help strengthen and advise the public of this problem with the use of algorithms. We thought about, as Kevin has done, filing class actions, lawsuits in federal court that we're considering currently. We have had an opportunity to contact our legislators at the District of Columbia to talk with the government, the agency that actually funds this particular government agency in DC that runs the Medicaid program, to provide testimony at the oversight hearings for these particular agencies, so that not only are the legislators aware of what's going on with the impact of the algorithms, but the public as well. Like Kevin said, telling our story, our client story, is key. So getting media attention on cases that are high profile, again, to get the word out about the impact that these algorithms are actually having on the health services of individuals. And trying as best we can to keep those avenues of communication open with the government agency so that they can troubleshoot quickly any issues that we are having or see. And while that really is helpful for individual cases, we do understand we have to go beyond that, because there's so many people out there who are not receiving legal services from LCE or any other legal services program who are needing assistance. And so there actually needs to be a broad change in the policies as to how this program is run and how these algorithms are used to generate the number of hours that people are entitled to receive. And then lastly, what we've started to do in DC is we have a group of community partners where we meet together on a monthly basis to discuss these cases, to discuss the decisions that are coming out from various judges. Because for us, part of it also is an access to justice issue, because depending upon what ALJ you get, you will get a different decision. And to make sure that the chief attorney and those that are in leadership at Office of Administrative Hearings are aware of this, so that there can be more uniformity on the decisions that are issued with regard to these cases. So keeping an open and consistent dialogue with community partners, so that we can share information, we can bounce ideas and strategies off of one another. Again, if we identify a particular issue that's involving one particular nurse, we can have that definitely addressed by the government agency. So just keeping the avenues of communication open with these government agencies and with the legislators is also an important piece.
Thank you. Tammy, the cases we discuss in the report, as you described a few moments ago, had an impact not only on how the algorithms affected the plaintiffs, but also how they would affect other people with disabilities going forward. What was it like for you to challenge these tools, to bring attention to your story, and to find allies to work with you?
Well, it was stressful, and I had to be put on anxiety medicine. But I called senators, email senators and representatives, and anybody I could think of, and let them know, like she said earlier, and let them know what was going on, and that I needed my hours, and that it was important to go back to the old way, to the evaluation where the nurses come out, and that a computer can't feel, I can't observe people. We're not all the same. We have CP, but we're not all the same. So we have to have different hours, different types of care. And this machine, this program categorizes us all in the same group. And we're not. We have a CP person who can walk. I do not walk. I cannot walk. I cannot use my hands good. But CP people do walk and can use their hands and stuff. And so I contacted legal aid, and they helped me tremendously. Kevin did. And but we have to do it every year. Every time my assessment comes up, we have to do it every year. And if they would just, do away with it and let us get back to our normal routine, we have enough to deal with our pain and our situation, that we don't need to fight the government every year.
Thank you. It's really good for us to be keeping in mind. Let's turn now to some questions from the audience. So our first one is about the algorithms that are being used, particularly for Kevin and Tina. Are the algorithms, as far as you've seen, usually procured from third parties or designed by state government agencies themselves?
I can go ahead with this. So it's been a mix. I mean, at least nationwide, it's a significant mix. So you have some state agencies, like what have happened in Idaho, for example, that they just decide they're going to build something out themselves with very little data. You have what we experienced in Arkansas, which is a combination of basically a research consortium that operates internationally, that standardizes assessments, and then some members of that research consortium wearing a different hat develop the actual algorithm and the data science that supposedly underlies why somebody with Tammy's, for example, with Tammy's needs gets only 32 hours a week, as opposed to somebody else with a different set of needs getting 21 hours and somebody else getting 48 or whatever it may be. So you see that. Then you also have private vendors like Optum and I don't mean to target them, single them out, but they're actually active in Arkansas right now, and other private vendors, along with the consultant class, McKinsey's and Deloitte's and all of these folks, who then come in and kind of hawk their stuff to state governments, right? And say, oh, you know what, you want to cut benefits, or you want to develop a more efficient, methodology of allocating limited state resources. There's all that good happy speak, false happy speak for how they sell this stuff, but they hawk this stuff to state governments, usually on the basis of very questionable, if non-existent science, bad data sources, all sorts of incompetence along the way. And government officials all too often are happy to pay out money to achieve these policy ends that they wouldn't be able to accomplish if it was actually subject to real public oversight and accountability.
And for the District of Columbia, they actually use a tool. It's called Interrai, Interrai. And it is a tool that is used in other jurisdictions as well. But I believe each jurisdiction has the opportunity to tinker with it and kind of create a tools particular for their particular jurisdiction, so they can decide like what questions they want to count towards the score. They can decide what the range will be in determining what the score is to rate one of the ADLs: bathing, dressing, toileting, mobility, or eating. So the scores can range anywhere between like 0 and 4, totally independent to total dependence is needed. But as Kevin said, there's really nothing that we have seen that explains how the actual score is translated into hours. And it seems to be oftentimes at the discretion of the nurse assessor. So if you get a 2 in bathing, there's a range in hours you can receive. You can receive anywhere from 1 hour to 2.5 hours. So does a 2 always equate to an hour, 1.5 hours? That we have never been able to get the answer for. And we don't believe that it is consistent like that. We believe that there's a lot of subjective information that's going in terms of the nurse assessors and the information that they are and the data that they're putting into the system. Also, in terms of the questions that are being asked, sometimes there is more than one factor under a category. So you may have a category that says toileting, and under that toileting category, you may have other factors such as transfer to toilet use. So the question becomes, is there a separate score for the transfer and a separate score for the toilet? And then are they averaged together to get you a total score on toileting? Those questions remain as well. And then we have found that for the tool Interrai that the district uses, there are a lot of questions that are asked that do not factor into your final score. So even though they're asking questions that might deal with, do you need assistance in preparing your meals? Do you need assistance with light housekeeping? Those kinds of IADLs, those answers or those questions are not actually figured into the final score. So all of this extra data is being collected for what purpose? And so those are kind of the issues that we've seen. Again, it's an algorithm tool that's being used in other jurisdictions, but each of the jurisdictions has decided how to tailor the questions and what questions they're going to actually use to determine an actual score for their purposes for that jurisdiction.
Another question that we got is about Medicare and Medicaid. This audience member asks, Medicare requires dual eligible plans to use AI as part of their determination of needs process. Are contracted entities like managed care organizations that contract with Medicaid and or Medicare that use AI, are they subject to the same legal obligations as the state? Tina and Kevin?
And I can just speak a little bit about what's happened in colleagues who are in kind of managed care settings, and they're often having to face the question of proprietary information, right? And for all the non-lawyers who are with us, of course, in certain cases, private actors can say that something that they develop, including an algorithm, is a trade secret, and therefore it shouldn't be released to the public, or if it is released to the public, should be released in a very limited protective way so that only the minimum number of people who need to see it can, and then it's destroyed afterwards. So yeah, I think the challenge for many advocates in managed care settings is getting those algorithms, right? Because that can be a big fight. The other issue is potentially bringing those private actors into liability. There's a great paper that was written by a couple folks at the AI Now Institute, Artificial Intelligence Now Institute, which you haven't heard of, you definitely should. Jason Schultz and Kate Crawford wrote a paper called State Actor Theory, where what they try to do is say, okay, we're going to get the private vendors, whether they're managed care entities or these other folks that are hawking these algorithms, we're going to try to get them and make them part of the lawsuit so that they can be liable as well. So yes, that's one of the big frustrations, and how our legal challenges play out against managed care situations is still something that varies a lot and has to be seen.
I would echo what Kevin said, and just say that, initially when we reached out to the government agency that runs the DC Medicaid program, we received a little pushback as well on getting the actual algorithm and the manual that actually then describes and explains how the algorithm is actually scored and how it's maintained. And again, we received some pushback as well. They finally decided that they would allow, well, they said in the notice, they give you like a web address or something that you can access the information from their website. But most of our clients, legal services folks, don't have the ability to do that. They don't have the technology to do that, nor the wherewithal to do that. So it really was a non-answer. But they finally did allow us to get a copy of the manual. They were very secretive about it. You can only have one copy. You can't share it with anyone. But even the manual accepts, again, I honestly did not really explain how the algorithm works. And whenever we have these cases and we bring that up before the judge, when we're cross-examining the government witness, they aren't able to explain either how the algorithm works. So they're using this program that it seems that they themselves don't even really understand how it works. So that has definitely been a frustration. So even if you get it, how helpful it would actually be in reality is kind of a crapshoot.
Thank you. Another question that we have is about the tools being used across different states. How similar are these tools? Are we seeing them more often made by the same vendors? You mentioned Intereye a few moments ago. Do we know if that's used in a lot of states for making HCPS determinations? And also, Intereye has been claiming nationally that its tool is proprietary. Do we have any kind of information about how accessible the tool is, how commonly it's used?
I think in the research that we've done, I think we have discovered like a handful of jurisdictions, maybe like 8, that use the Intereye tool. But in the information that we have been able to obtain from Intereye, they themselves say that their tool was never created to be used in the way that it's being used, which is to basically determine how many personal care aid service hours an individual was entitled to receive, based upon the information that we've been able to obtain through our research. So they themselves indicated that this tool was never created for the purpose for which it is being utilized by many jurisdictions.
Yeah, and I'll just add, so Interri is what made the Arkansas tools. So they have different assessment tools for different kinds of populations. I hate that word, right? But people who are subject to, the elderly folks who are have functional needs, or people with disabilities who have functional needs, or people with intellectual disabilities. So there are all these different kinds of tools. Interri is in roughly half the states, I think, at the last time we looked. And they just provide the assessment. So this is an important thing for advocates, for anybody to know, is there's a difference between assessment and allocation in all of these processes. Assessment is gathering the data, right? What information do you get? Somebody goes out with a computer and asks Tammy a whole bunch of questions, right? 286, in fact, to be exact, in Arkansas. Then allocation is, what does the state do with the information that they've got from the assessment tool? And that can be a different thing. And the people who make the assessment tool don't necessarily make the allocation algorithm or whatever it is. And so that's something for everybody out there who's trying to get a grasp on maybe what's going on or what you're facing. You need to understand that assessment and allocation are two different things. And I can go into that more at some other point. And I'm always happy to talk offline if people have really in-depth questions about any of that.
Thank you. Another question is about also what states are doing. We talked in the report about some cases where the court has ordered the state to work with advocates to develop a better tool to assess benefits. What does that better tool look like? Are there changes that states particularly should be trying to make? What can state employees do better? This is something that we are also looking at in the report. We have recommendations particularly for state governments as well as attorneys and people with disabilities. So what would you recommend that states do differently?
First, I'd like to pass that question to Tammy to answer first, and then I'll be quiet and follow up whatever Tina and Tammy have to say.
Well, I just think they need to reconsider everything and just think about the people and how we live out here. And I just think they need to think more about us and our habits, our ways of having to have things done. That's all.
I agree. What Tammy says. I think the problem with the tool, first of all, no one has come to us as advocates in the district to say, how can we make this tool better? I wish they would. We would be very happy to give them our thoughts and ideas. But I think the problem, as Tammy identified, is that the tool does not take into account the individual need of the individual person. It assigns a number and a score in the blind without totally considering all of the needs of an individual. And so I don't think the tool in and of itself can ever be effective in determining how much aid or assistance a beneficiary needs. I'm not saying that the tool should necessarily be thrown out. Maybe it should, but I don't think it should be used just in a vacuum. So having also to make sure that that nurse assessor or whoever is conducting the assessment has access to the beneficiary's medical records, that they have access to letters from doctors and other healthcare professionals, that they have other supporting evidence about the client's needs, and they utilize all of that information in determining what hours, whether or not the client meets the level of care to be eligible for the program, and then determine how many hours the person should be entitled to. And again, as I said, making sure that there are assessments on the needs of the client that are not just the ADLs, but the IADLs as well, and incorporating that evidence in determining the number of hours that a beneficiary is entitled to receive, and making sure, especially for our clients, that cognitive issues and the assistance is needed. I mean, you may have a person, who can eat on their own, so they get a 4 in, eating. But when you have a further discussion with them, you find out that they don't even know where the kitchen is. They couldn't put a package in the microwave and cook it for themselves. So those kinds of issues that are specific to the client themselves, that are outside of the standard questions that are being asked in the algorithms, is very important in determining what specific care this specific beneficiary needs. And I don't believe an algorithm in and of itself can ever make that determination.
I think that leads to the larger point of whether an algorithm is needed in the situation, right? Obviously, it's kind of right now it's cool, and they're being pushed, and they're being pushed to achieve oftentimes, policy ends in the name of so-called efficiency or even fairness or all of these other things, but that doesn't mean that you need one, right? So what are you actually trying to do, and do you need an algorithm to do that? If you do, there's all sorts of ways to, or if you decide as a state agency or something you're going to do that, then there's all sorts of ways to potentially make it work in the least harmful way possible. In the government decision-making process, you have the contracting side of things. You have then, once the contract is awarded, you start developing the algorithm, you start doing your data science, you start figuring out what things you need it to do. In all of those processes, most of the time, in our experience, state agencies are very leery to allow anybody outside in, and they don't make any effort to actually engage the people who are going to be affected by their damn tool, right? So nobody called Tammy or anybody else who was going to be judged by this algorithm to ask them, hey, what do you think of this, right? Or even, here's how this might affect, people with particular care needs. Nothing. They're really just closed off to that. So I think some of it is the state agency culture and seeking intentionally public input and making that input count, right? Because I can tell you that a lot of times they'll listen, even if they're forced to listen to the public, they might just ignore the public, right? And say, well, that's not convenient for us, so what are we going to do? And then deployment, having clear senses of what do you anticipate that this algorithm is going to do, right? So somebody with Tammy's care profile gets this much before algorithm. How much is somebody with Tammy's care profile supposed to get after the algorithm? And then, is that projection okay? Are you comfortable with that? And then what happens in practice, right? And there's a lot of times the state agencies we see they don't make forecasts. They don't make predictions about what their tool is going to do. They don't do modeling. So there's all sorts of horrific stuff that goes on in the state agency. Some cases it's good people who just don't have access to the information, and sometimes it's people who don't have power, like the good people who know the program and know how it's going to affect are maybe not political appointees, and they don't have the power that the political appointees do. So anyway, if there's any state agencies out there who want some ideas, there's a lot of good resources, and I'm happy to always direct folks in the direction of where they might get more information to.
And the only other thing that I would add, I think that at least in DC, we have seen that the courts also recognize the inefficiency of this tool in determining the health benefits that individuals need. And I just have one particular decision that was issued recently in one of our cases, where the court found that the assessment tool itself is rife with problems. It might well be a good starting point for determining the level of someone's PCA hours, but it certainly should not be the be-all, end-all of the determinations. So even the courts themselves are recognizing this tool is imperfect, that this tool is ineffective, insufficient in determining the number of hours that a person would need. And there's a human element that is not being taken into account of, so that individuals like Tammy and other individuals, that their specific needs are being considered in determining, how many hours they are eligible to receive under this program.
Really glad to hear that, especially considering that question came from Tasia in the chat, who is a state employee, was asking about ways that states can be more transparent, what the right moves are. So there are people looking actively for that feedback, and our report also lays out recommendations, particularly for states, which you can see when we publish it tomorrow. Also want to acknowledge a couple of things that came up in the chat. One question was, other than procedural due process violations related to deficient notices, what are the potential legal claims to substantively challenge the use of the algorithms themselves? And you will see that the report lays this out in detail, so look forward to that tomorrow. Also, there have been several really great observations in the chat. I would encourage you to look through it. One of them was from Fern from Gold Coast, Australia. If someone wants to see what happens when algorithms go wrong, search for Australia's welfare agency, Centrelink, and terms like algorithm, robo-debt, or debt recovery. So please do take a look at everything else that's being discussed in the chat. It's a wealth of knowledge right now. Considering the time, unfortunately, we'd like to just proceed to our final remarks. Thank you, everyone. As our report discusses, and as our panelists have expressed today, it's dangerous when states rely too much on algorithms that decide how much people get in benefits without taking the critical steps to make sure that decisions are fair and accurate. It causes real harms, especially when they cause disabled people to have to live in institutions to get the support they should be able to get in their own homes. To prevent these harms, our report provides several recommendations for state governments, lawyers, and disabled advocates. We recommend that states meet their constitutional requirements to ensure people's due process rights. States should keep the public informed and involved when selecting algorithm-driven decision-making tools, and states should use reliable tools that they regularly test and update to ensure fair decisions. We recommend that lawyers follow the leadership of disabled people and seek guidance on algorithmic bias from experts. Lawyers should explore strategies and identify partnerships to bolster their litigation efforts. And lawyers should reach out to people who don't have the resources to share their stories on their own so they can amplify their efforts together.
It's 2 o'clock.
Finally, we recommend that people with disabilities seek support from legal aid and disability rights and justice organizations and through social media. Disabled people can communicate with lawmakers by submitting comments, writing letters, and speaking at government meetings. And disabled people can work with the press to share their stories and concerns. Thank you so much to our panelists and to everyone for joining us today. Our report, Challenging the Use of Algorithm-Driven Decision-Making in Benefits Determinations Affecting People with Disabilities, will be available tomorrow on CDT's website, as will a plain language version of the report. Thank you, everyone.